Welcome to our discussion on gaining the trust and business of homeowners seeking healthier homes. Thank you for coming today. I'm Amy Belay, Vice President of Contractor Success at Pearl Certification, and I'm pleased to be hosting this webinar in partnership with the Building Performance Association. We're passionate about bringing, actually, can you go back, Joe, and just leave it on the Pearl side? Thank you. We're passionate about bringing valuable insights and information to help you grow your business in the new world that we all find ourselves in. A couple of housekeeping items. Everyone is muted given the number of attendees. If you have questions, please use the Q&A function located in the bottom toolbar on the right-hand side of your screen. I'll be managing the questions and our presenters will answer as many as they can. We are recording this webinar in addition to streaming on Facebook Live. And we'll share the link to the recording as well as a link to the slides a couple of days after the webinar is completed. And you are welcome to use the chat box throughout. It will be monitored, but please use the Q&A function for questions. So for those of you who don't know Pearl Certification, Pearl documents the high-performing energy features of a home so that they can be valued at the time of sale or refinance. And we do this through an elite network of contractors who meet stringent qualifications to certify the work they install. Our contractors report on average between a 5 and 15% increase in close rates when using Pearl on every job. Next slide. A little bit about our sponsor. So the Building Performance Association is a membership-driven trade association dedicated to advancing the home and building performance industry. Built upon decades of experience and providing industry support through key areas including advocacy, education, programs, networking, and more. To learn more about the Building Performance Association, you can go to the link at the bottom of the page here. There will be contact information for myself as well as for EPA at the close of this conversation. Next slide, please. Oh, where's your
back?
One
more.
There it is. So I'd like, So I'd like to introduce our presenters and then I will ask them to give a little bit more flavor to their experience and what they're going to bring to the conversation today. And I'm really excited about this lineup. So Larry Zarker is the CEO of the Building Performance Institute. He oversees the BPI's network of over 10,000 certified professionals and BPI Gold Star contracting companies. He was instrumental in moving BPI towards the Healthy Home Evaluator certification and the Healthy Housing Principles Reference Guide. And I've greatly enjoyed a working relationship with Larry for over 10 years now. Kevin Kennedy is the program director of the Environmental Health Program at Mercy Hospital in Kansas City. He is an environmental hygienist and certified indoor environmental consultant with 30 years of experience. And I've really enjoyed seeing the crossover into the energy space with Kevin's expertise. Joe Medosch is a healthy building scientist for Hayward Score. And Joe has been evaluating homes for over 20 years. And I've been really excited to have some interesting conversations with Joe and the Hayward Score and Pearl over the last several months. So looking forward to a further conversation. And I will turn it over to you guys.
Okay, Larry, you are up.
Okay, thank you. Thank you, Amy, for the introduction. Let's go back one. Yeah, there we go. We have an ambitious agenda today. First, we're going to introduce the new Healthy Housing Principles Reference Guide, and that is built on the 8 Healthy Home Keep It principles, and we'll get into that later, but discuss what they mean to you and to your business. We're going to make a distinction between this kind of stepping in Healthy Housing Principles certificate and the more advanced Healthy Home Evaluator certification. Try to identify what in this pandemic world that we're living in, consumers are looking for. We'll provide an overview of the IAQ devices and how they help solve problems. You know, what do the research findings tell us, and how do we, about how homes affect the occupant health, and the new world of virtual assessments and how that can build confidence with consumers. So you may have seen my blog in the past. I was the cobbler whose kids had no shoes. You know, I had a 100-year-old house in Maryland, and it was at the bottom of 2 hills, and we had a lot of water in the basement, and I had a trainer in the house say one day, you know, why is your basement so wet? And I said, well, it's only when it rains. And our kids had all sorts of problems in the fall with respiratory with issues, and they were soccer players. So it was the dawning of my understanding of this field. So then we bought a house that was just 30 years old. So what possibly could go wrong? And, you know, do you see anything wrong with this bookcase? You can click through to the, yeah, so you start to see some rot, and then we can click through to see what was actually behind there. We removed trim, removed the bookcase, we exposed the drywall, the fiberglass bats, and saw the rotting framing. And so I did that work. What I want to point out to you as contractors in this field is that you may be working on a heat pump and see that there's a slope toward that corner. That may not be, you know, in your scope of work, but if you see that water is draining there, and we confirm this with a water test, you may have, the customer may have issues in their home. In our case, a big deluge produced very little water, but it stayed in there and created this kind of condition. You can help customers identify these issues and solve them. So today, I want to build on our certificate of knowledge, kind of the entry-level building science principles, what we have had in the market for 7 years. It's the fundamental of building science, and we built on that with core certifications for building analyst, multifamily building analyst, QC inspector, and energy auditor to create a higher tier healthy home evaluator certification that uses one of the core certifications for its prerequisite. But what's exciting today is that we've now added a second entry-level kind of broader scope certificate of knowledge called the Healthy Housing Principles. So we have the building science principles, and in the market, we have the new Healthy Housing Principles coming out. And I want to emphasize that these are, both these guys are written in plain English with clear graphics, with excellent images that have captions that build on the text. So these are reference guides you can come back to. It's in the 8 keep it principles: clean, dry, pest-free, contaminant-free, safe, ventilated, comfortable, and maintained. I've got them memorized now.
You read them.
We'll get into those in depth in a minute. Going to the next thing, those who challenge the certificate of knowledge exam can download their certificate for use in their business. And if you have an interest in learning more about the certificate, I encourage you to go to bpi.org/HHP-info, put your name and your email address in there now, and we will provide you with information as this reference guide and exam come out. We're very close to sending it to the printer. It's not quite live, but you can gain access to it by putting the information in today.
I do want to highlight one thing, that make sure it's clear that the certificate, whether it's the building science principles or this healthy housing principles, requires no previous or prior certification. Anybody can just go online, purchase the reference guide, take the exam. You do not need to take any training. There's training that'll be out there for people.
Right.
But in general, this is something that is a self-serving certificate of knowledge that is incredibly broad for people, contractors, homeowners, and here's a kind of a laundry list.
One more point on the certificate: you can, once you have prepared for it, you can take the exam from the convenience of your own computer, so you don't have to go to a test facility to take that exam. We're targeting a lot of different audiences here, obviously technicians and the office staff, insulation, air sealing contractors, home performance contractors. We're building out to a larger network where you see on the screen a community health worker or an in-home nurse or someone from a call center, an HVAC company. Bottom right is like a student's learning through virtual reality, or an HVAC technician working with a customer and seeing things in the home. You start to view more broadly. And lastly, you know, an inspector who says, what's behind this wallpaper? You know, that doesn't look good. With that,
wait 1 second. So one thing I do want to point out is that if you want to be an energy auditor, energy anything, if you want to be an HVAC technician, you probably could go to YouTube and learn darn near everything you wanted, from people that do it great to people that don't know what they're doing. But there is very few resources at all to learn how to do a healthy home assessment, or how to talk to somebody about their home becoming healthier, or potentially their conditions in their home. So this reference guide will change our industry in terms of how we can go one step further to actually work with clients, and they can actually learn more themselves with or without you. So I think it's a great resource that'll change how we just have the discussions.
Right. And with that, I think I'll turn it over to Kevin.
Well, so the idea is that we are all humans who have various health problems. Everyone on this call will likely have a chronic health condition sometime in their lifetime. And we don't manage our health problems at a hospital. I work for a hospital, and we certainly see patients on a regular basis in the hospital, but they manage their health at home. Their home plays a key role in how well they can take care of themselves. And ideally, homes have been designed and built for people to occupy them, and it'd be great if the house promoted health and well-being, but unfortunately, it doesn't if it isn't properly paid attention to, maintained, and designed properly. Along with that, people, back up please,
Sure.
People have their own behaviors and practices that aren't necessarily good, that contribute to environmental exposure, and they have unique health conditions that, if things exist in their home, they can be significantly impacted. So it's really important for them to have a resource, have people in their community, experts with this knowledge, who can help them better understand the role their house might play in their health. So just to touch on this, the significance of this problem, next slide, let's look at childhood asthma, where we won't be able to cover a lot of the evidence and health conditions, but just looking at one disease. This is a common and serious environmental disease. People react when they're exposed to something in the environment, and right around, back up a second, about right around 8 to 9% of the population across the United States has this disease. The children, and actually many adults, close to 10% of adults, have this disease. It's really almost an epidemic, and it's about exposure in the environment. The cost, next slide, is astronomical. It is $56 billion in annual direct and indirect costs. This is annual costs, and it costs the average person around $3,000 or $4,000 a year in those direct health costs. So there's a tremendous cost there. There's been lots of research on home interventions to show specifically the impact of the home interventions on asthma. But now, here in the last couple of years, there have been a couple of these reports, like this one from E for the Future, and there's another one, HomeRx from DOE, back up, that specifically connect weatherization activities to specific changes in the home environment that result in improvements in health symptoms and overall improvements in health and quality. Next slide. What we also know, here's a fascinating new report from Harvard. They've got a couple of these out where they have evaluated consumers' concerns. This one is specifically to healthy home remodeling and is a follow-up report after interviewing consumers. This is really important information. I highly recommend you read this report, because it says there is an incredible need in the industry for people who have healthy housing knowledge, because this is what consumers are looking for. People with children have a very high interest in their house. And then in particular, you see the center circle, kids, families, couples, 25 to 44 in that age range are particularly interested in investing in their house in ways that improve the overall quality of the house to make it healthier. Here we're seeing that it's specifically younger homeowners. These are people who are buying houses. When they buy the house, they are specifically interested in the environmental conditions in the home and spending their money smartly to improve the indoor environmental quality of the house because they are concerned about the potential health impacts. In particular, when surveyed, indoor air quality, almost 80% of people asked, indoor air quality was a primary factor. But if you look at the top 5, past water quality, safety, and indoor issues, and then even the top 6, all of those fall under the healthy home principle. All of those are issues that with proper knowledge and education, you could be advocating for or helping consumers make decisions about these concerns that they have in the home. This slide is particularly interesting. Hit it again there, Joe. I want to blow up on this one side because what it shows is, yes, they get their information from building professionals and the internet and from talking with their doctor. And doctors in the last 20 years are becoming much more aware of the role environment and really the role of home play in health. But most of people's concerns and the reason they're looking to invest is because they have symptoms of illness themselves. Many of your clients, and unfortunately, many of our younger population are struggling with chronic health conditions, and often how they manage that is related to the environment they spend time in. We know younger generation spends 80 to 90% of their time indoors, so the indoor environment is critical to their health. And now, because of COVID, more than ever, people are worried about they're spending probably closer to 98% of their time indoors. So they're particularly interested in making sure that space that they're spending almost 24 hours a day in has good indoor air quality, that the systems that are used to manage the home are in good shape. They're willing to invest in servicing and upgrades. They want it to be quieter because now they're there all the time, and they want it to be comfortable.
So that leads us into talking about the actual 8 healthy home principles. And one of the things we wanted to bridge during this webinar is that there isn't much of a difference between energy efficiency conditions that you're doing in the home or evaluating and interventions and upgrades to many of the healthy home interventions and upgrades. That many of the things you're doing actually for energy efficiency fall right in line with actually improving the health of the home. So, and notice I do say health of the home and not the occupant. Your goal is that you can control the home. I cannot control the occupant. So you want to be cautious about how you communicate with your the occupants of the home, because I cannot guarantee your asthma will go away, but I can guarantee you that I can eliminate many of the factors that may impact your asthma. So that's a significant separation, that you're really focused on making the home healthier, and there's a good chance based upon evidence-based conditions that this could improve that. So you can see that there's, I really don't read the slides exactly, but you can see that there are the things we're doing that are normally thought of as energy, they actually have a health impact. It's not that difficult to make the jump from one to the other. It's more about the language, how you talk about it, and how you market yourself. And I'll have some examples of contractors at the end that do the exact same things you may be doing, but boy, they just totally change the marketing language, and health is now wrapped into what they do. So that's your goal, is to make for happy, healthier, comfortable occupants. So the reference guide covers these principles. It is your goal. By the end of the session, you will be quizzed. I will ask everybody to verbally say them out loud, kidding, as to what they are, okay?
In order.
That's right. So to me, I separate them in a variety of ways. So I know there's a dry clean in the beginning, a couple of free things there, and then safe. When I put my thumb up, it means the home is safe. So number 5 is always safe. Ventilated and comfortable are usually why you're probably at the house. You're either addressing some kind of comfort issue, you may be addressing a ventilation strategy that hasn't been implemented. This is where air sealing, everything comes into play. So those are things that are there, and they're probably there because they really didn't do a great job of keeping the home maintained, and that's one of the things you can educate your clients about, and they will then be committed to you for a longer term commitment there. So we're going to go through the 8 briefly. So Larry, why don't you start us off?
Okay, so again, this is from the reference guide. Our primary author is Kevin Kennedy. We've had others helping out on the development of this. It's very much in the same format as the building science principles, where we tell you what you're going to learn, what the objectives, learning and objectives are, and then we cover all the topics. I want to make sure that we understand this is a reference guide. We don't intend you to memorize it, but it's something you can go back to and learn from it again and again. So keep it clean is essentially the starting point. We all know about a sink full of dishes and what can happen if you allow that to happen. Unfortunately, some of these photos are from my own house, and I apologize for that. But keep it dry, to me, is absolutely critical. And it does tie into some of the other keep it's, like maintained. If you don't keep the roof in place, then you're going to end up with water problems, and water problems beget other problems. So dry is absolutely essential to a healthy home. And as Joe just kind of alluded to, we used to talk about air sealing, but now we're talking about contaminant pathways. He'll get into that a little bit later, but we want to keep it pest free. We want to keep the pests out. And there are ways to do that without using poisons, without affecting the people who are living there.
Again, air sealing is one of those components to controlling your pests, right? Right.
And contaminant free, we're all used to using all sorts of cleaning agents, paint thinners and the like in our homes, and scented candles and aerosols, and we're subjected to secondary tobacco smoke. This chapter really gets in depth on how steps you can take to help your customers keep their home more contaminant free.
This is something that is an immediate marketing value for you, because most people are over chemically inducing their house and themselves. That the poison control reports are up significantly right now because people are either using too much, not knowing how to do it, or they're using chemicals that are inappropriate. So if you're looking for a simple marketing strategy right now, is to send out green and healthy cleaning options that will disinfect and will provide the solutions they're looking for a COVID-free reduced home.
And again, these are samples from the book. This is not, this is just to show you kind of the gist of what we're getting at here.
Kevin?
Just the idea that this really expands the kind of information and relationship you have with your clients. This is the kind of information they're looking for. There's lots of practical information, and they consider people who work on their house and especially their heating and air conditioning system to be a trusted source for advice. So this is really useful information that you can offer them.
So I will make note that many of these seem like very simple phrases, and they are intended to work for any occupant of any caliber. It's just a simple concept. So keep it safe doesn't mean you have to list off a bunch of criteria about what is safe. It's a general concept, as well as the contractor can now explain, and you have the role of going into what some of those safety features are, from handrails and trip hazards. And of all of these, this is the one that I believe is not addressed by most contractors, and it is the greatest impact on your occupant. This is a multi-billion-dollar, $30 to $60 billion event that happens. One hit trip fall is a $30,000 event for somebody. So you want to make sure that you're trying to point out things that to them they're like, wow, I'm so glad you did that. And some contractors now will be like, well, we have a carpenter who can come by on Thursday and fix this if you'd like. So you're now providing more services for your clients, and now they know they can come to you for a variety of services that they may need in their house. So keep it safe goes for a variety of stuff, and you can start to see the contaminant free with chemicals and dry and with pests. These things really kind of overlap, and it always isn't just one condition. You understand the house as a system. These also work as a system themselves, so you can understand how they kind of overlap. So for those of you that aren't aware that the HVAC, the V is actually for ventilation. So those of you that use the term HVAC, you should be thinking that you are concerned with their ventilation strategies and think about how they can improve those. That an exhaust fan somewhere in the middle of the house is the weakest of our ventilation strategies. And the more people are now looking to understand what is an HRV or an ERV, or what is fresh here in my house, And this is the time when people are willing to invest $5,000, $10,000 in something to their home, knowing that they're going to work in their house now for a long time. So if you're looking for, again, one add-on that has a good price tag for things you do in the house, it's service the unit and then recommend something they can do to get fresh air in their house as a nice upgrade. You're doing this all the time. This is keep it comfortable. The one thing that we will try and encourage you is that you also want to work with the occupant to understand what those conditions are. And you may have the husband who says it's too hot and then the wife who says it's too cold. And that's your job to figure out how to, make that environment more habitable for everybody at the same time. So the last is maintained. And this is something that sometimes if you were working at Larry's house and you saw that there was a bad drainage issue near his AC condenser outside, then you would have now realized that this is a poorly maintained area and he should have somebody investigate that, or you could have somebody come over and investigate that. So the goal is to keep your clients informed and they'll stay with you longer. Let's try and put this as an example of how things happen. So let's start with, it could be a flood. It could just be a major water issue. Maybe it's the dishwasher or something that had a major significant amount of water that showed up in the house, okay? So now we end up with a potential of, things that show up visibly. We call it mold, but it really was a excessive moisture issue that actually happened. This can actually lead to asthma exacerbation. So mold and high moisture are something that could, if somebody has asthma or has COPD or others, this can be a significant issue in their house. So you may be showing up for trying to fix their water damage or assess something like that, or tell them they have this, but understand that there is a health impact to some of these. So my water intrusion also could create structural damage. This could be a long-term or a slow leak or something that now has compromised the foundation. Structural damage leads to pests and insects and a variety of deteriorated issues from fire to injuries. So you can see how home as a system is coming to play with a healthier view. Once I have pests and rodents, now I may be using pesticides. Pesticides leads to, again, whether the actual rodents themselves and the cockroaches are asthma triggers, as well as the pesticides are not something you really want to have around your kids or your house. So pesticides also lead to contaminated food, or kids can have access to these. We also have a whole series in the pest section that goes with a healthier way of dealing with pests. So I'll have Kevin mention that in a second. So all of that comes to play, as you can see now, as the home as a system. So integrated pest management is a method where you actually get the homeowners more involved than just having somebody come by and spray once a month. So with that, Kevin, why don't you take us to the next
So
level.
the idea then, you've seen from one incident related to moisture that you lead to multiple potential environmental or healthy home issues within a home. So the idea is that you are taking the, similar to house as a system, the healthy home principles are applied in a comprehensive, holistic way. So it's really an integration of the two. So you add this knowledge to your skill set, and then in applying it, you're looking at the whole house, but now from a different point of view. So yes, I'm thinking about the house as a system, and I'm teaching families about how, because most families don't think of their house as a system that works together. But now I'm thinking about the individual contaminants and the individual problems in the home. Joe, advance the slide,
Sure.
please. So now you have to start asking about potential for dust mites in some areas because of the amount of dust, the amount of airflow, the amount of humidity. Safety, like window guards. You're already doing the heating and air conditioning servicing and maintenance. And then we talked about the moisture issues, but now you're looking at the whole house as a whole system, and how does that work together? So you have a new opportunity for how you engage and work with your clients to help to inform them about their home and how to invest effectively. So a key part of that process is the walkthrough and a visual assessment. It's very important, and the research is very clear that the most important part of assessing for health, safety, and environmental risks in homes is a visual assessment. It is you applying the built-in assessment tools you have. It's observing things, it's listening, it's any kind of odors, it's just feeling out either soft surfaces or weak rotted wood. If you want to try tasting the mold on the wall, you can. I don't recommend it, but that's another way you could use your another assessment tool. But you're really going to start going into places that you maybe haven't gone before with new knowledge, and also communicating with your client about best healthy home practices associated with that. Joe touched on it earlier. Next slide.
I want to add one thing. So this center picture is something that we use in our training, because you can see he's trying to do a moisture assessment, but right around him are chemicals. Above his head is a cleaning condition. So you can now see that there's so many simple things that are around your visual assessment or assessment you're doing that can enlighten your knowledge or also share with your clients. So moving those chemicals out of the way should have empowered him to hand them something that says, here's some green cleaning alternatives. So you can see now where one is always leading to the other.
Lots of opportunity to interact and engage your clients about a host of things. And we want to make sure we touch on this idea. You do not, and I've had a lot of people ask me, you do not have to talk about health, talk about people's health per se. We have teams who go into homes, have been in a couple thousand homes. And our role, even though I work for a hospital, my role is not to talk to people necessarily about their health. My role is to talk about the environment. We might talk to, in our case, to their physician because we work for a hospital, and the physician might advocate about health, but our role is to help them understand the home, how they can improve the home, and what are the health and safety risks that we've identified in the home, and how can we potentially connect those. But you can't absolutely connect them. Focus on environmental improvements. That's what matters. And really, through trainings like the Healthy Home Principles, you're gaining new knowledge, new science, and new evidence-based recommendations that you can add.
Wait,
But
that's it. Yeah,
nope,
yeah.
Unfortunately, the world has changed. Now, we all want to take that visual assessment, and now we've got to start doing virtual assessments. So just to touch on that a little bit, what does that look like? Even my teams at the hospital, we have switched over to virtual assessments. How do we connect with our clients? How do we engage them in a way that's valuable and can teach them important information? So we have to develop new ways of talking with them. We have to ask out loud about who might be in the room with them. We need to inform them about who's in the room with us. We need to think about lighting. We need to think about even possibly having a script. We can ask them to send us photos, or how can we get information about the house. If we're going to want to visit the home, that's going to be under very strict conditions, and we can talk more about that in a second. But we have found at the hospital, the virtual assessment process is very effective. We base ours on the telehealth system that is being used by lots of clinics and hospitals nationwide. And actually, the research evidence shows that consumers like telehealth visits. They are just as effective as a regular doctor's visit as far as checking in with a patient or with a family about how someone's doing. You can use that process and have families walk you around the house. They can guide you through as you focus on their concerns and questions. It's a different way of talking with people. It's a different way of gathering information, but it works very well. And we have found just taking screenshots as a family walks around, we're able to gather really useful information, and it really opens their eyes when they have to actually show you things and you ask them, show me where the water heater is, show me where the and they, in some cases, they may not have even looked that closely at their furnace filter or something. So it's very informative for clients.
As well as it gets them engaged. Now they have an active role in their home versus somebody coming in and just walking away and going to the hot water tank. Now they understand where it is and potentially what kind of conditions could show up in the future that they need to call somebody about. So there are huge bonuses to this, as well as the amount of time you're at the house could be reduced if you do this well.
Well, and we use a multi-visit model. So after we have collected that information, we follow up with a home report and educational discussion. So we've sent them the report ahead of time. They can review it. Here you can see we have it online available for them to look through it. We can talk about any of the literature or actions that we're recommending to them. Based on what we've seen, we can address the concerns that they talk to us about during the walkthrough. So we use it to build a relationship with the client and to work with them to identify what the issues are. And then we make recommendations for home interventions and for home repairs. So for us, we went through the process, and you might consider developing a workflow diagram. This on the far left shows the key staff that might be involved in interacting with clients, and then what are their steps in the process as we look at converting our home visit process to a virtual visit process. What are the components of that that we need to be aware of, and how does it change our roles and responsibilities? So at the same time, it engages and educates the client as they walk around the house. It reduces the need of the total time of the assessment. You can do it more quickly. You're not having to travel back and forth. Lots of the work can be done by non-technical people, but ultimately it doesn't replace the assessment entirely, and it doesn't replace the need maybe for some kind of diagnostics, because we certainly collect them ourselves in some of the work we do. So it at least minimizes the time you have to be at a home on a regular basis. So you still have to go. So there's still, because you're having to go, and now everybody's wearing masks and you all look like burglars or robbers, there's a whole new trust issues. So you've got to find ways to properly identify yourself. You got to wear uniforms so people know who you are. You'll be speaking through a mask. You can expect them to wear a mask. It's very important to maintain a communication, to be extremely courteous and respectful during these times.
So this one I'll chime in. So I work for Hayward Score. I have a healthy building science, as we mentioned in the beginning. So we're looking at virtual opportunities. So this is something that you can actually have your clients go do. We actually work with a couple of contractors right now that use this as a preliminary screening kind of a service to learn more about their house and allow their occupants to learn more. So it's an online survey, and notice that at the top that I added the /tool. That actually gives you our new 2.0 version, which actually gives interactive recommendations based upon the questions that the occupant or you answered. So if you say you have a crawl space, no matter what you said, I'm going to ask you to go look at your crawl space, because you may thought it was dry and sealed and learned that actually it's not. It's not dry, nor is it sealed. So we try to make sure we get you engaged in your house. Some things are as simple as adding mats to the front door, inside and out. So they can do some, and many of them also require maybe a contractor, and some of them definitely are requiring a contractor for ventilation strategies and upgrades. We have the Keep-Its have been around a long time. I don't think we really stressed that these things have been probably 10, 15, 20 years, maybe longer than Kevin has been in the industry. They have just been a foundation. And there were 7 of them, and now 8 has been this concept of comfort, which meant that it brought energy into the health component. And now it's just a strategy that's now moving through. They're all equally value energy and health. But we also thought that there's some things that actually people were like, hey, I got tools. I want to use my tools. How can I do healthy homes with tools? And many of these you're doing already. You are doing some type of temperature assessment, or bulk moisture, or dew point, or humidity in the house. If you're BPI, you are checking for combustion gases or leaks from carbon dioxide is something that's now people are a little more sensitive to. Maybe it's an indication about ventilation strategies. You are doing some type of pressure flow from a blower door to doing pressure tests throughout the house. And the one that we think is going to become more of a common thing that contractors are going to have a particulate counter. This actually determines if your filtration system is working correctly. This determines what kind of things are happening in the house. So many people will vacuum just before you show up because they want the house to be clean. And you find that there's a lot of particulates because their vacuum cleaner is not that great. So here's another opportunity to educate them about getting a better vacuum to do that. So these are the basics. Oh, yes.
There's a few questions that come in. Do you guys want to take a few questions, or you want
to
get to
go ahead.
Okay. So I think this one's probably for Kevin. What are the demographics of the incidence of asthma, specifically in relation to income?
Oh, well, the vast majority of asthma prevalence is among lower income folks, low to middle income, in part because of the neighborhoods and communities that they might live in. There's more environmental risks in some lower income communities. There's lots of historic and sad reasons for that, related to historic racism and other things. But it's not a disease that's unique to a demographic. It certainly affects all ages, and the prevalence levels are still high among all incomes. And allergy too is much higher now than it was 20 years ago. Far more people, around 20 to 25% of people have some kind of allergy. So also a significant healthy home issue is just the allergies people are trying to manage.
Thank you. Another question, and this might have been related to a specific comment, but I think it's relevant across the board. What part do air purifiers play in all of this?
Well, they can play an important role. Joe is touching a little bit on it, understanding the level of particles. Air purifiers, portable air purifiers, absolutely. There's new research out in the last 3 or 4 years that shows them to be extremely effective. There have been some more formal tests of the use of them. There's things you need to know. It's covered in the book, actually. There's also important things to know about whole house systems and the use of furnace, higher grade furnace filters, and there's some specific new information from EPA about using higher MERV rated filters. They've really changed their thinking on that in the last 3 or 4 years because there's been some new science out. So it's important to look at some of the new information from EPA. We touch on it a little bit in the book as well.
Yeah, EPA, it does have 2 documents out that are specific to that. So,
yeah.
But the one thing I will remind you is that any purifier is better than no purifier. And but many of them have electrostatic components. It's just kind of built in. It's like a bonus feature. Many of those may give off what are considered low-level ozone. We encourage you to turn that off. They'll work just fine without that. You can also make your own very efficient and maybe slightly louder than the other one you may spend $300 on. But you can just take a regular box fan and add a 3-inch MERV 13 filter to the back of it, and find that it's highly productive to capture an enormous amount of particulates throughout your house, and you can move it around easier than you can some of the other units. So we do have a link to that on Hayward Score. So if you're looking for more information, we can reach out to you.
Right, and we're getting into filtration in a little bit too with the slides.
Yeah.
Okay. So there's a couple more questions, then we can move on. Does the virtual assessment or walkthrough, Kevin, that you were talking about require the client to have an iPad or other device?
Ideally, it's best that they have some kind of mobile device. We've actually been exploring dropping off a device if they don't have one, like an iPad that's already set up for them to just touch and have everything set up where they can contact us. But yes, they do need to have some kind of phone that has the ability to show a screen and be able to show a live FaceTime or Zoom-like view. There's many different technologies available to do that, but yes, they do need some kind of smart technology.
That will be the limiting factor in some of this. So your flip phone will really not help you, and there is maybe an elderly challenge. I have grandparents who are that are parents that are challenged with some technology, so there may be limitations. I do think that, as Kevin mentioned, and Clearresolve has already headed down this path, that there's the concept where I send you a text, you open this, and it's a link, and it has the ability to say permissions to your pictures and video, and it guides you past the technology hurdles with a major investment in the technology. So you're going to see soon that these kind of things are going to be very common. As fast as you thought the phones evolved, this method would now evolve. Within 2 years, it'll be incredibly common that you have some system that is doing a virtual assessment that then allows you to then come back out and still do the physical conditions you have to measure. Well, but it may require you come out that day because you see something that is a serious, significant issue.
We also have a service area of about 200 miles from the hospital, and we just think it's going to be smarter in the future if we ship an iPad, overnight ship it to them, have it, like Joe said, already pre-programmed, so they just touch and they can walk through and then ship it back, rather than us having to drive, round trip back and forth about 8 hours. It's worth being able to do that and have that technology. So we're looking at it as a permanent approach to how we will do many of these assessments.
And BPI is looking at all the various approaches to virtual assessments and is initiating a project very soon, like next week, on how you develop a protocol that can be used across the country for doing the virtual assessment in single family and multifamily housing.
So virtual assessments are here, and even I'll mention Rob Minich in a minute, but he has his technicians on the phone, not just the person answering the phone. His technicians are on the phone with the homeowner, walking through Hey, where's your furnace filter? Furnace filter. You know, there's again a great learning curve that happens, and now they understand more about it and what they can actually do over the phone, and saving their client money, which means you're going to call them back when they do have a bigger issue.
Awesome. There are a few more questions, but I'm also noting we've got about 15 minutes left. So why don't we
should push
keep
through.
going through? Yeah.
So you may be using stuff like this, infrared cameras, which are now incredibly common. We're talking about tools again that are similar things, but there is a way to now combine these with potential your health condition. So being uncomfortable, you think of it as an energy loss, but no, it's actually a comfort issue, which also can be a health issue that's going along. So technology again is improving. So I can hand my client an iPad, I roam around with my gun, and I can show them what's going on at their convenience. And you can add these things to your phone. And the one in the middle is this combination of moisture and IR. And I remind you to be cautious about what it's telling you, because when things are blue, it doesn't mean they're wet. This is the thing where I think more people are looking to invest more in or do stuff. So like I mentioned earlier, particulate counters, people want to know what are the particular conditions in their house and why and what's causing them. We're now having a portable VOC and formaldehyde sensors that are now becoming affordable. I mean, affordable is in like less than $2,000, less than $1,000. So yeah, they're out there. The last one is people are complaining about chemicals and VOCs and formaldehyde in general. And one of your best methods is actually get a sample that's done in the house for about 2 hours, costs a couple $100, and they can do it themselves, or you can service this for them and send it back and get an amazing profile of all the conditions that are in there with an idea about what they may be caused from, whether it's candles or furniture or cleaning or a variety of stuff that can show up on those kind of reports. And of all of those tools that I just mentioned, there are people that can help you get trained on those, including a couple of people on this call. But many of the BPI training partners are very familiar with combining energy and health to train you on some of those conditions. If you're doing a blower door, I want to remind you to ask several questions and look in specific places. So if you're not asking them, do they have asthma or other breathing conditions before you do a blower door, whether you're pressurizing or depressurizing, then you're kind of failing the environment and what you're actually assessing. And do look in the crawl space in the attic before you do that. And you may decide, I'm going to come back another day to do the blower door test. And I've concluded that the blower door test is an acceptable thing to do in these conditions, as long as you or knowing the house said they were sick, and you shouldn't be there in the first place anyway. So HVAC contractors, you are just as much a part of air leakage and pressure boundary issues as anybody else. So things leak around your boots, your ducts leak, all those things cause actually a significant amount that you should be testing and using some type of pressure pan to determine what you can do to improve that performance. And not only is it just the ductwork, but at any fixture, when you have a blower door going, I can go around any opening on the ceiling, the wall, the floor, and make an association as to what actually is connected to the other side of that wall, that light fixture, whatever those are. And you can actually use little small probes to do that, or find out if I'm connected to the crawl space or the attic. So these are things that should be part of your basic diagnostics. At Hayward Score, we believe that the occupant is the most sensitive sensor you can get. So you can spend $10,000, $50,000 and walk around the house and may find that your readings are kind of low, but yet your occupant still has headaches or nosebleeds. And now you need to work with the occupant to figure out what are those conditions, when are they happening, where are they happening, get them to close off rooms and do a variety of things that are more difficult to go through in this presentation right now. But you should now think of your occupant as the best sensor in the house. So if they have an issue, don't think that your instrument is going to confirm or deny that. Trust that they know what's happening to them, their house, and their body, and then figure out a way to resolve that. Caution on the COVID zappers. There's a variety of these things. You could use them under different names. They may glow certain colors, but if they're claiming to do something with COVID, be cautious, because most people don't know what it does with COVID. It may actually kill certain viruses or kill certain bacteria, but you want to know that you have independent evidence basing those facts, not the manufacturer. The manufacturer makes a variety of claims, and do not follow those. You want to follow what kind of independent studies have been confirming that. Oh, and in case you weren't sure, these are all bug zappers that may be reclaimed as something that could zap the air in your house. This is one that is actually the most common question I get almost once a week. Some contractor says, Joe, I want to get an indoor air quality monitor and take it over to the homes while I'm there and monitor what's going on. I said, the only thing you're going to monitor is how much you're impacting the house while you do your assessment. So these are incredibly limited. In fact, most of them, if it's a consumer grade, it's a trend indicator. Okay, so it does not do a lot. There's a varieties that are out there from different ways to use them. Some of them actually have great reports, but you want to make sure you do your homework and understand what it is you're doing for you and your client. And they're only as valuable as actually where you actually have them and for that amount of time. They're not a blood test, okay? So you cannot say that, oh, I left it in the living room for an hour and I can tell you everything about your house. It's not the case. So again, they're trend indicators, and they're only as good as at the time where you used it and when it was. Some are $20 that actually can do a great moisture assessment in your house. I'm going to go through quickly 4 contractors that are doing phenomenal work that are bridging energy and health. So this is Building Doctors. They're out in LA. Notice that they're marketing in the top right. This is all energy stuff that they have rebranded. In fact, they have the clothes, they have ambulances. That's all based upon healthy homes. But it is energy retrofits that they actually do, and have been able to rebrand this as a better way. This is out in Maryland. This is Total Home Performance. They were doing mostly crawl spaces, then got into air sealing, and now they actually focus on healthy homes. They're doing the same exact stuff, but now they're educating their client and marketing completely differently. Ecoperformance Builders, they're out in San Francisco. They focus on actually getting a monitor in your house that they know they can trust, and they use the data to determine not just energy efficiency, but actually what's going on in your air. And the last is Rob Minich up in Maryland also. So you can notice in the middle here at the top, he's actually got an indoor air quality link. He gives information, and he also is leading the curve on virtual assessments, but he's one of our guinea pigs in terms of trying to determine if they can do a mini score to get people to engage in healthier environments. So these people are doing stuff. You're welcome to go back to their pages and actually see what's actually happening. And many of them, you can say, give a call, and they'll actually give you advice as to what they're doing. This is something that Rob and others are doing. They're actually increasing the filter to changing where it is so you get a better increase. And some people are actually using their filter, their monitors to actually determine how much it improved the indoor air by these kind of conditions. So there is a way to use monitors in conjunction with what you're actually doing as an upgrade. There's several devices that are out there. This is Haven. It actually works in your AC, your duct system. Brown has one that's coming out this year that it's sensors that move throughout the house to control any device in the house that's a ventilation. And Panasonic has something similar that does the same thing. So there's a sensor, and then they can control a variety of ventilation strategies throughout your house.
Yeah, why don't you bring all of these up? I mean, bring this back to the business that you're in, and think about the customers you have. Right now, there are a lot of people coming home from the hospital who have been compromised by the virus or by something else. You know, the home becomes paramount to their recovery. Or, you know, in the case of asthma and respiratory infection, you know, you've got Aetna saying that just going to the emergency room costs $800, and a hospital stay can cost over $8,800. So think about kids with asthma going into the hospital 2 or 3 times a year. That starts to become real money. And so we need to bring managed care into this so that we can say there are ways to reduce those triggers. Don't overlook trips and falls. $30,000 for the cost of a hospital stay, over $31 billion in 2015 spent on Medicare for trips and falls. We can do those things. Medicaid is starting to reimburse for healthy home assessment. Our healthy home evaluator is qualified in some states now. The utility programs are starting to shift more toward comfort, health, and safety, plus energy efficiency. Energy efficiency is more on the back end. But don't overlook this opportunity to help your customers not experience those trips and falls. Now, this is a complicated slide, but, you know, I got a call last week from someone who said, I need to position my business around healthy homes. Who do I talk to in my community? Well, you have a lot of health specialists in the community who are dealing with problems that people have. Talk to them. Let them know you're there. Let the public health agencies know that you're there. Don't forget the educators. Teachers don't want kids out of school. Help them understand that you can provide services. And so there's a wide variety of ways that you can interact. And don't forget the media too. So in conclusion, we know that COVID-19 has changed the way people view health in their home environment. They need to adapt. We need to adapt with them. More people are searching for ways to protect their health in their homes, but they don't know what to do, and they're scared about buying shiny objects that don't necessarily improve their lives. So start with visual observation, add diagnostic testing. Certainly encourage your employees to get educated on the importance of evidence-based problem solving. And lastly, I encourage you to look into virtual assessments. A lot of the contractors have been held out from being in the home, and now they're being allowed to at least get into the assessments. So it's a brave new world that we're entering into, and so we're all looking forward to working with you.
So thank you, Larry. So we've got time for, well, we'll see. We have time for at least a couple questions. So one, going back to the virtual assessment, can I assume that clients with disabilities will require an on-site assessment? I think that might be for you, Kevin.
Yeah, that's also depending on their disability, right?
Yeah, say that again. And I had some internet issues here.
Yeah, no worries. So the person posed the question, can I assume that clients with disabilities will require an online assessment on site?
No, not necessarily. Ultimately, there may be one visit to the house, but there's a lot of information you can gather prior to visiting the home, and there's a lot of information you can communicate after visiting the home. It is true that we have complex medical cases, and for those cases right now, we know we're going to have to visit the home at least once, but we're trying to minimize the number of visits to the home, and we are finding we can gather a lot of information ahead of time, and families and patients, clients are comfortable with us communicating after the assessment via an online platform like this. And a lot of people who have disabilities are already using technology to help them manage or overcome their disabilities. So many of them are comfortable using different types of technology.
So, and again, on the virtual assessment, telehealth software is more expensive, likely because of HIPAA compliance. Is it necessary to have HIPAA compliant software for a virtual assessment?
No, and it isn't necessarily about having HIPAA compliant software. It's about who is delivering the activity and the purpose of the activity. Telehealth is the equivalent of a clinic visit. A home visit is not a clinic visit, and it's not a telehealth visit. So even though we may be using the same technology as our doctors when they might visit with a family to talk about a health issue, we're using it the other way around. We're using it to evaluate the home. And we have used Zoom and Microsoft Teams. It doesn't have to be HIPAA compliant, but it does have to be a secure channel. So if you can make it as secure as possible, that's what would be recommended. But the other important part of that, and I have some information if people are interested about phone etiquette. There's specific phone etiquette that telehealth world has taught us. It's really important. Practical things about lighting, about sound, about the background behind you, being professional, looking professional. You can't get up from your morning coffee, jump on the phone like many, or the video like many of us have. You are representing your business when you're online, and you have to think of it that way and what's in your background.
Well, as well as when you're talking right now, I'm looking at you, or you feel that way. But if I was like doing this and be like, oh yeah, I got that. Yeah. What did you say something? That actually comes across now live.
Yeah.
So there's a whole nother way of communicating once you're able to actually see each other. It feels as though you are there, and you get a lot more engagement out of the occupant.
The other part of that is they say, if you are going to look away from the screen, you need to tell people why you're looking away. You need to tell them when you start, hey, I have a laptop over here, I'm recording information, or I have a notepad. If it's okay with you, I'm going to be recording information while we talk so that I make sure I gather it all. You need to explain what you're doing. There's a lot more of explaining both of what you're doing and asking questions outside of what you can see on a screen. It's a lot trickier.
So it's a lot more engaging.
Yes, very much so.
Yeah.
Absolutely. Well, we are right about at time. I'd like to thank those who submitted questions and those who showed up today and listened to this really great conversation. I'd like to especially thank Larry, Kevin, and Joe for sharing your expertise and insights. And you can see that they've all put their contact information here on the screen, so feel free to reach out to them directly. You will be getting these slides after the fact, so you'll be able to get their information if you don't get it at this moment. Can you go to the final slide, Joe?
Yes,
Oh.
yes. It wasn't. I'm bringing it up right now.
Before we leave this, I've had several people in the chat say, now, how do we get more information and where's the URL? We have the website built for the Healthy Housing Principles. We haven't made it go live yet. That's why we put up that bpi.org/HHP info so that we can capture your information. As we have the information, we'll feed it back out to you. So use that and we will get back in touch with you.
Awesome. And just a final note, if you'd like to learn more about Pro certification, you can contact me at the email address there, and then, which is Amy Belay. And then the Katie Arnoff is with Building Performance Association. If you're interested in learning more about the association, it's a great organization. If you're not a member, I strongly consider offer up that it'd be worth joining. And with that, thank you so much for your time, gentlemen. And we'll be getting this recording out here in the next couple of days. Thank you so much.
Thank you, Amy, for having us. Thank you, everyone.
Yeah, thanks for
Thank you,
everything Pearl's doing. We appreciate it. Thank you.
Yeah, thanks for listening.
Thank you. Bye.